At Prevent Blindness, we promote healthy vision and access to eye care for all. We educate people about protecting their sight. We advocate for strong vision policies at the local, state, national, and global levels. We empower the blind and low vision community and their allies, and we celebrate their achievements. Here's your host, Christopher Horde.
Greetings, and welcome to the Prevent Blindness Focus on Eye Health podcast. This month is a somewhat unusual episode. We'll be talking about dry eyes. Most of us have experienced dry eyes at some point in our lives, and depending on lifestyle or genetics, you may experience it more often, but it can become a serious issue, particularly as you age. And we have lots of information that can help. We'll talk to someone who experiences the issue and the executive director and co-founder of the Dry Eye Foundation, and steer you to more resources that we've prepared for you. Additionally, we'll have more news and information of interest to the blind and low vision community and our allies. We'll talk about fireworks safety and also preview next month's episode. I'm your host, Christopher Horde. Welcome to the podcast. It starts right now.
News.
Prevent Blindness observes July as Dry Eye Month. Dry eyes is a condition that many people will experience at some point in their lives. Some estimates run as high as half of the general population. However, the National Eye Institute estimates that more than 16 million Americans have serious or ongoing issues, and the odds of developing the condition increase as you age. Dry eyes occur when the eyes do not make enough tears to keep the surface of the eyes lubricated. This can create discomfort. It can interfere with vision. And in extreme cases, it can do damage to the eye itself. If you believe that you are suffering from dry eyes or that you are at risk, please visit our website at preventblindness.org. There, we have assembled a web page of information about the condition, its causes, symptoms, and treatment. We also include some questions that you may want to ask your healthcare professional to see if you can be helped by simple lifestyle changes or if medical treatment is necessary. Once again, you'll find that information at preventblindness.org or click the link in our show notes. Prevent Blindness invites you to nominate a champion for children's vision. Through July 25th, Prevent Blindness is accepting nominations for the annual Bonnie Strickland Champion for Children's Vision Award. The Bonnie Strickland Champion for Children's Vision Award recognizes significant efforts by individuals or groups of individuals to improve public health approaches for children's vision and eye health at the state or national level in the United States. The award was established in 2014 by the National Center for Children's Vision and Eye Health Advisory Committee to commemorate Dr. Bonnie Strickland and her groundbreaking work to establish a comprehensive system for children's vision in the United States. Both group and individual nominations are due by July 25th. Visit preventblindness.org for application forms or for more information, or click the link in our show notes.
Feature presentation.
Greetings. Today we'd like to welcome our guest, Pam Gale. Pam Pam is a person who has dry eye syndrome. And this is a rather unique set of circumstances for people. And so she has come here to talk a little bit about her vision journey and also about her work as a vision advocate. Welcome and thank you for coming on the show.
Thank you, Chris. I'm glad to be here.
Now, first of all, to dive in, I think it's very important to sort of establish for listeners, you're in an unusual circumstance because almost everyone experiences dry eye, but almost nobody experiences it to the extent and to the constant ongoing extremes that turn it into a medical condition. So could you please talk to our listeners a little bit about your experiences, what it's like for you, and especially how you discovered that this was an ongoing medical condition that you needed treatment for?
All right. I started suffering from this about 20 years ago. And if I attach it to anything, it's probably the start of menopause for myself. So 20 years ago, I started to have sensation of, I was diagnosed pretty much at that time with chronic dry eye, meibomian gland dysfunction, bouts of uveitis, allergic conjunctivitis, blepharitis, and evaporative tears. I was treated for the most part with eye drops, and that's what my doctors said, try this, try that. I have been very lucky with my doctors as of 20 years ago. They've been pretty knowledgeable, I would say, and I hear stories of people who can't seem to find a good doctor, and that just saddens me because that's probably the most important part of the medical field for us is to find a good doctor.
Yes.
So I was given a number of treatments, and I can't begin to tell you how many I've been through, and different drops, different goggles to wear, I do have prescription glasses, and I've been wearing these for about 5 years that have moisture cup attached to it, and that's been a lifesaver for me. I mean, it's very efficient against fans and air conditioning and heating and wind and everything else that goes along with the dry eye. That's the beginning of my voyage, I would say. Before that, I took my eyes for granted until all of this happened. And then you start discovering that you better take care of them.
Yes. Now, your experience with doctors, you've mentioned how important it is to find a good doctor. Did you have experiences where you dealt with doctors who didn't understand your condition or were able to diagnose it?
No, I think the first ophthalmologist I saw, and I was living in Europe at the time, but the first ophthalmologist I saw when I was starting with these symptoms seemed to know what he was talking about and directed me towards, right away, the hot treatments once a day or twice a day or as often as needed. And he told me where to find heated goggles in Europe, and I'm still using them to this day. So I was lucky in that respect.
Good. And now your experiences have led you to want to advocate for people with your condition, but also in general for the blind and low vision community, but also for people to understand that even if their vision is currently fine, that they should get regular checkups and take care of their vision. Please tell us a little bit about your experiences with advocacy.
I went to Washington, D.C. last July, a year ago, which was Dry Eye Month. And I was asked to go by the Dry Eye Foundation, which is out in the Pacific Northwest. And 36 of us were there as patients with dry eye. And we went to see our legislators up on the Hill to talk to them about Dry Eye Month, what we were going through, some legislative things that had come up that we hoped they would sign off on. And I was paired up with a young woman in her early 30s who suffered already from dry eye. And I think that was a shock for some of these young staffers that we met, because we mostly met with young staffers who were asked to meet with us and who are the ones actually that write up a lot of legislation. So we met with them. We told them our stories of how long we've been suffering. And my young counterpart, who is from the state of Georgia, myself from North Carolina, we met with 3 of her legislative offices and 3 of North Carolinian offices. And each time told them that it was interesting and important for them to realize that it has no age barrier. During that week or a few days in December last year, I was among the panelists that were there and among the patients of dry eye. I was surprised how many men were in our group and how many younger people. I thought that the older women who suffered from menopause and hormonal disruption were the vast majority of the dry eye sufferers, and it's not the case. There are a lot of young people, and I think there are going to be more and more with the use of screens and everything that is using our eyes nowadays. And there are young children who are suffering from dry eye. So my advocacy started last year. 2 of us from the Dry Eye Foundation took the training course this year with prevention of blindness and the aspect training within that group. And we are again going to Washington, D.C. this June to meet our other patient friends and to legislate on the Hill, or hope for legislation for the prevention of blindness.
I think that's fantastic. And you make a very excellent point that I really want to emphasize. We like to talk on this program and keep people in mind that older women are a population that do experience eye conditions percentage-wise more than many groups. But eye conditions do not discriminate. There are conditions that affect people from childhood on, men and women both, and that everyone really needs to try to have as much preventative care as they can reasonably get.
Absolutely true.
Now, we talked a little bit about Prevent Blindness's Aspect program. For folks who are not familiar with it, would you tell them a little bit about what you learned in the Aspect program?
It was a fantastic 10-week experience. It may have been longer than that. I'm not sure of the dates, but we were probably 50 or 60 people in the group with all different aspects of vision loss, vision problems, and I think I was the only one that had severe dry eye. And it was humbling to be in with a group and to be in a training situation with so many people who suffer from very, very serious or blindness itself. I was touched by the different aspects of the group and I don't know how to explain what it brought to me. It was so important to be in that group, and I just thank every day that I was able to be a part of it. The training was fabulous. Participants were ever ready to put themselves out there and go beyond their comfort zone and just revel in the fact that we were all in this together.
Mm-hmm. I think I'm a person who went through Aspect as well, and I think you've expressed it very well. Do you feel your experiences are going to lead you on to further efforts to advocate for your condition?
I'm going back again not only in June with prevention of blindness, but in July I'll go back for the second year with the Dry Eye Foundation. And we're right now organizing that for the July session. And I'm looking forward to both trips to the capital city and meeting with staffers and possibly senators, House of Representatives, if they're in the offices, to discuss all these important issues.
Very good. And I also do want to mention for our listeners, if you want to find out more about the Aspect program yourself, go ahead and visit our website at preventblindness.org or check our show notes. So while we've got you here, Pam, I would like to ask, is there anything that you wanted to mention, any particular causes that you support, or anything about your condition that people don't seem to generally know or understand that you would like to share with us at this moment?
I think the dry eye condition itself is an insidious problem. Most people think that we can just take an eye drop, put it in, and stop talking about it. Actually, I don't, excuse me, I don't think we do talk about it a lot, but we live with it. And to be very clear, it's not life-threatening. In theory, it's not vision-threatening if it's taken care of. But it's life-altering, and it's changed my life in the past 20 years. Simply out there for millions of people, probably 50, it's hard to tell because people are not told by the doctors what they have, or the patient maybe is not communicating clearly what his symptoms are, his or her symptoms, but it is estimated that 50 million people suffer from dry eye just in the United States. And that's a hard figure to comprehend because I don't think younger people have maybe talked to their doctor about it yet or have been screened. It's just a large number of people, and it's going to be getting worse. The hours of screen time that we all spend is just going to, because we blink less, we're going to affect our eyes more. We're causing erosion on the cornea. It's going to be more and more people. Add more millions to that figure.
I think that's an excellent point, and thank you for making it. Pam, I think that's most of the stuff that we wanted to go over for this particular interview. I thank you for being on the program, and I think with people like you advocating for the cause, that's just going to help people going forward. Unless there's anything you particularly wanted to add, I just want to say thank you for your work and for your advocacy.
I'm pleased to do it. I'm proud to do it. And I thank you, Chris, for this opportunity.
Special guest.
Greetings. Our guest today is Aidan Moore, the Executive Director of the Dry Eye Foundation. Aidan has also been part of the Aspect program, one of the Aspect cohorts, and is an advocate for awareness and for the treatment of people with this condition. Welcome to the podcast, Aidan.
Chris, thanks so much. As you said, my name is Aidan Moore. I'm the executive director and co-founder of the Dry Eye Foundation. We're a small nonprofit that's based in Paulsbo, Washington, and we serve patients around the world. Our work goes back about 20 years, and we officially incorporated as a nonprofit in 2018. Personally, I work on many of our programs, including community support, research, safety, and advocacy.
Okay, thank you. And now one of the things I'd like to discuss first is kind of the scope of the problem. It's one of those things that's a little hard to define. Almost everyone experiences dry eye, but only so many experience it so consistently or so severely that it becomes a medical syndrome. So, could you tell us a little bit more about the condition and how many people are affected by it?
That's a great question to start out with. I'll just caveat this to begin and say I don't have dry eye myself, but I've been working with the community for about 10 years. And as you said, a lot of people are affected. And the estimates that we have range from 16 to 50 million people. So that's a really widespread. Not everyone's diagnosed with dry eye, not everyone sees a doctor about dry eye, but that 16 million number, those are about the people that are diagnosed, and then a smaller set of that will be the ones who have the severe symptoms. Those are the people that are coming to the foundation. There can be all sorts of causes from the environment to lifestyle, surgeries, drugs, autoimmune condition, age, hormones, and more. For some people, it's a severe pain in their eyes, greediness, burning, light sensitivity. Other people have more like flare ups at some points or might just be aware of their eyes from time to time. People do experience those symptoms pretty frequently. People visit multiple doctors, they'll struggle to find treatments for a while, and a lot of the costs are pretty high for out of pocket drugs and procedures. And I think my last point here, too, is that the term dry eye doesn't really do it justice. There's a huge quality of life impact, mental health impact. And I've just heard from a lot of patients over the years. Some have been homebound. Many people give up driving at night. People have to adapt to like the wind or AC, reduce their time on screens or reading books, just the activities that they enjoy. And then in terms of depression and anxiety, those can definitely be affected by dry eye as well.
Thank you. Those are several excellent points to make. Now, as far as some of the things we've already touched on, the scope of it and the way it affects people, what sort of options? You mentioned that some of the treatments can be very expensive. What sort of options are available to people who are experiencing this sort of thing?
Absolutely. So there's a whole range. It might start with over-the-counter eye drops or warm compresses. Frequently, people do eyelid hygiene as well. So you might use like a lid wipe or a spray to make sure your eyelids are clean and that you're not, producing film that's going to cause more inflammation. People take supplements like omega-3. Then they might move on to one or more prescription eye drops or an FDA-approved drug for dry eye. There are specialty medical devices and prosthetics that you can use. And there are also in-office treatments, but sometimes these treatments aren't covered by insurance. And insurance coverage does vary significantly for treatments.
Okay, good to know. Now, another thing you mentioned that I'd like to circle back around to, you mentioned that you yourself do not experience dry eye. So I'm wondering what sort of led you. We always like to ask people a little bit about their journey, how they ended up where they are now.
Totally. It was a complete accident. I have a family friend who started the foundation. She and I started the foundation together. She also has a small business online where she sells dry eye products. So at one point, I approached her about working for that company. I started there in 2016. And then in 2018, we started the foundation together. And I feel like I just really connected with being able to speak to and listen to people and just see all the ways in which kind of dry eye isn't recognized in society, that sometimes people feel lonely with this or that they don't have options. And I've just found that being that voice that listens to people, takes them seriously, and is able to offer resources has just been hugely gratifying personally. So I feel like there's a lot of work still left to do in the space for dry eye.
Well, thank you. In your role as executive director, I understand that the organization has been pretty active as far as its advocacy work. Please tell us a little bit more about that.
Of course. So July is Dry Eye Awareness Month. Dry Eye Awareness Month has been commemorated for like 20 years now. We've done different activities, kind of marketing campaigns during Dry Eye Awareness Month. It was 2 years ago that the Alliance for Vision Research started inviting us to the Dry Eye Congressional Briefing. And then last year, we organized an Dry Eye Advocacy Day with the Alliance for Vision Research. So we brought 30 patients to DC. They talked about raising awareness about dry eye and a couple important points like, treatment access, federal research funding for dry eye treatments, and just product safety because we've seen a lot of eye drop recalls. So just making people aware, I think, of those stories of people who live with dry eye has been impactful for, the members of Congress and their staff. so they can kind of connect real stories with the policy asks that we're making of them.
Fantastic. And that actually brings up naturally another topic. As we mentioned, you've been part of the Aspect program. And I, in fact, was a member of an Aspect cohort myself. So I always like to ask people a little bit about their experiences, what they thought, and to try to have them express, at least briefly from their point of view, what it meant to them to participate.
It was a hugely impactful experience for me. I think the community aspect was really strong, and I know we had a really fun and supportive cohort. We were the gumbo cohort, I think cohort 11. But I'll say my advocacy work, on the federal level has only been going on for less than a year. And I think planning our first advocacy day last year, there were some times where I was like, oh my gosh, are we going to be able to pull this off? Maybe we still have time to cancel. Are we going to be able to change anyone's mind? But once we got to DC, it really felt right. Patients were so excited to share their story and kind of make something positive out of, a rather negative life experience. They were standing up for other people, seeing their story in a new light. And I got to do the same on the Aspect program. I always struggle to say, like, I don't have dry eye. Why are you working for the Dry Eye Foundation? What's your motivation? And I think writing my story helps me clarify that. I have other experiences in my life where I have struggled with mental health and have felt like I'm the only one. No one understands what I'm going through. And I think when we bring together people in a community, whatever those issues are, I think for dry eye, people do so much better when they have people to ask questions and they're like, I'm not the only one going through this. And maybe there's some tips and tricks that people have collected over the years that we're able to share. I just love being part of that program. I know that the staff that runs it is incredible, and I'd love to have more dry eye patients in the Aspect program so we can continue our advocacy.
All right. And now speaking about the population, the dry eye population, for folks who are listening and who are not familiar with the foundation, please give them a little information about the best ways that they can find out more information or reach out if they would like to try to contact you.
Absolutely, yeah. So I'll share our contact information. We have a phone number, 800-484-0244 is our dry eye helpline. Those calls usually ring through to me, and I'm available to, pick up the phone, figure out how we can help. I often refer people onto other services like our dry eye Zoom groups, or we can do a more in-depth helpline call with another patient advocate. We have Facebook groups. We have a free dry eye guidebook on our website. We have some informative, blog posts and educational resources. We have a YouTube channel with lots of recordings and webinars. So that's 800-484-0244. And our website is dryeyefoundation.org.
Excellent. And I'd like to tell our listeners that depending on where you get your podcasts, if you didn't catch that information, it will be in the show notes. So there should be a link in there that you will be able to use as well. Okay, so tell us a little bit about sort of what's in store. What sort of things is the foundation looking at or considering for upcoming projects or events or so forth?
Absolutely. So we're just in the middle of recruiting for our own Dry Eye Advocacy Day year 2. We're going to be going from July 16 to 17. So I've been running some webinars and info sessions to get people, interested in joining. So if you have dry eye symptoms and if it's made a big impact on your life, we'll have a letter that you can sign on to share with your representatives about some of the changes you'd like to see, what you've been through. So that's a great way to support kind of awareness during Dry Eye Awareness Month. We're currently in the middle of a big eye drop recall. You can always follow updates at eyedropsafety.org. We had some brand name eye drops that were recalled recently. So we take safety very seriously when we follow recalls and warning letters from the FDA. So that's another big thing for us. The last thing I had notes on was on the mental health side. I think that's one of the biggest reasons for me that I'm in this work. I think sometimes people just don't know what they're in for and can't really see things getting better. But we found a lot of success, just helping people, giving them resources, offering them reassurance. And I've seen a lot of people get better over the years. I think when you start out, you don't really know what's going to happen. We like to talk about dry eye as a chronic pain condition. So it doesn't mean that things will never get better. It just means that we can use chronic pain strategies and understand that after kind of an acute phase, you might just be in a cycle of flare-ups and remission. So doctors oftentimes are able to treat signs of disease that they see, but patients can kind of be stuck dealing with the symptom relief by themselves. So we offer help with treatments and symptom relief like moisture chamber glasses that a lot of people don't know about. We can give advice on eye drops. So self-care is really important. And, people come to us when they're struggling. They might not think that things will get better. But I've seen a lot of people improve, find the treatments that work for them. It just takes a right amount of time. And I think there's a lot of reasons to hope. There's new treatments that are being developed. We go to conferences every year where we see the amount of money that's being put into research. So I like to help people just, figure out what the next step is so that they can continue, living with dry eye. And I think, yeah, on the mental health side, it's easy to just kind of assume the worst, but I've seen a lot of people get better, and we've talked in a lot of mental health conversations in our mental health support group, and just dealing with that depression and anxiety, I think is really, nobody wants to deal with it, but it can be better to deal with it in community too, and talk to other people who understand.
All right. An excellent point, Aiden. Thank you for sharing that.
Yeah, thank you.
Okay, so by and large, then I would just like to mention to our listeners, if you are experiencing dry eye on a regular basis or severe flare-ups, some people who are dealing with other eye conditions may not have thought of this as a separate individual thing. Now that you've heard Aiden, if you want to outreach to the foundation, we've got the information in the show notes. Please do reach out. Our guest again has been Aiden Moore, the Executive Director of the Dry Eye Foundation. Thank you so much for being a guest on the program, and thank you for the work you do, Aiden.
Thank you. Thanks for having me.
Announcements.
Prevent Blindness reminds you to practice eye health and vision safety around the 4th of July. 4th of July is the most fireworks-intensive holiday in the United States. Both official and informal fireworks displays will take place all across the nation. Additionally, the period running up to the holiday and immediately afterwards are also full of fireworks use. Government statistics show that the month surrounding the 4th of July is when almost all fireworks-related eye injuries take place. So, even after the holiday is over, Prevent Blindness urges you to practice extreme care when it comes to fireworks. Fireworks are inherently dangerous, and even responsible adults can have accidents. We strongly recommend that fireworks displays be left to professionals. If you would like to see a fireworks display, please find the nearest professional event and attend that instead. We wish you a safe and happy holiday and safe vision to you all.
Listen to the podcast from our website at preventblindness.org or subscribe to it on all major podcast services, including Amazon, Apple, Spotify, and YouTube. This has been your announcer, Corey M. Snow.
Thanks for joining us for another episode of the Prevent Blindness Focus on Eye Health podcast. Looking forward to next episode, Prevent Blindness observes August as Children's Eye Health and Safety Month. Prevent Blindness has a long history with the express purpose of protecting vision, especially that of infants. Please join us for a series of stories highlighting issues of importance to all of us. Thanks for listening. If you have friends or colleagues who might benefit from our podcast, please recommend us. We're still a young podcast and looking to grow. My name is Christopher Horde. Until August, share and enjoy.